But I know, in as far as I'm concerned, you know what even stunned me a little bit is when I looked at this kind of list, a long list of things of equipment that they have told us. And no wonder the thing is Commission of Health Facility Incentives Agenda. I don't know what it's called. Incentives agenda. Incentives must be having a lot of things. These are incentives, but I think incentives will go beyond this one that we are receiving. So Rafa has really been with us and doing a lot in the area of sexual reproductive health, and we are sincerely grateful. At some point, when I ask, when we see these partners come to us, I also USAID funded. I don't know. Last time we corrected whether we got an answer. Are you USAID funded or otherwise? You are not USAID funded. You are not. That's the only good news. You know, we are starting to get regrets from that fundraising. But you know, now you see we are scaling down our programs because of trouble. But we really thank Ram for what you have invested in us in terms of infrastructure, many things that will speak for themselves when you move around. They are doing lots of tidying up in our facilities, including establishment of structures in some facilities. A lot when it comes to equipment. I think it's not the first time we're seeing equipment. We've also given us equipment now. When it comes to capacity building, the mentorships, the capacity building, the mentorships, the ongoing mentorships that we are giving to our medical officers, facility interviews, we can describe a lot of things that Ram is doing and the world has not changed. So we really sincerely welcome you and thank you for these initiatives that are causing a very big impact in our health service delivery educators in the Kasese. I don't want to go beyond and speak a lot about. I know my cow also speaks about you, he speaks about you as he gives you welcome, and allow me to pass it over to him to really welcome you to his district. He must be very excited. I found it. He knew he was coming for a meeting here, but I found him standing with me. And I know the people are very good at looking very good. It was like, hey. So we really thank you and over to him for the remarks that we can pursue the program.
The ECHO in church health. And the other responsibility I've been given by my senior is coordinating partners in this. And even tomorrow we are having a quarterly meeting of all partners in this. I want to welcome the executive officer, Kasese, and your team, and the neighbors. You're welcome. It is really, I was confused when I saw those modern equipment, and she met me there. We have been seeing, is this for me? Is this for the office? Because now, he said, oh no, you will see the list, and the allocation. We are so excited, and very privileged to have such equipment coming to us. We have had sort of funding in very many fields. And when you get a partner who identifies need in the sector and you provide, very important, and we are glad and happy. Our role now is making sure put to use and sustainably manage what is coming to us. I have immediately looked at what is the total for Kasese, 1,471,000. That is much. Government alone cannot do it. Government alone cannot do it. It is needed, it is required, but partners coming in, that is very key. That is very key. We are so glad, and very, how I wish at all units. You know, now we are going to get challenges with guys who want to be where they are good things. Yes, they will want to come and disturb my GHO and my personnel. Because they have seen good things. Yeah, that type of screen, that the way it is, and these are other equipments I've seen. Really, someone will want to enjoy that comfort there. And now the other thing, I have seen Kalibu, for example. If the chief executive had reached Kalibu, he would take that other perspective of Kasese. You know, people have not known Kasese. But Kasese in those views. The real Kasese.
I was supposed to be in the morning tomorrow.
So, reaching there is you say, God, why did you punish me? But you have people, the community. You've been there.
She cried.
She cried. She must cry. She must cry. That was my first deployment as a sub-counter chief. We claimed sub-counter. Yes. And I said, yeah, I've come to serve. I have to serve. And those people are heroes who are serving there. Who are serving there. They are heroes. We chase them. And now they are getting motivated. They are getting motivated by seeing this type of. So what I can say, we are so appreciative. Thank you. How I wish to reach, for example, such equipment going to Buhira is also this side. Yes. But if we go, for example, to Ihandiro and Chitoro, very center things. Toru and Ihandiro.
Yeah.
Have you been there?
Yes, we had Chitoro in the first phase. The 6 years expired.
That's why you have taken Kanyat. How I wish the word was for Kanyat would go to Chitoro. Because Kanyat is a bit low. But in Chitoro, you are near heaven. You know, we believe that heaven is up here. So when you are in Chitoro, you are near heaven. You are touching almost the sky. So, yeah. But how I wish such a plans would go all over to these other things. And as you plan, as you assess the needs. But data is very important. Data collection and submission with these partners. Yeah, I'm very impressed, but I wish to stay and reach every health center. And also even the headquarters here, we are writing somewhere. Yes. You can see our office. But it is not well grouped with some other things. We can also be thought of. You know, they should not only find those things. So I want to end here and we say for us, we shall continue working well with the partners and asking them to roll over to reach us. Kasese is a region, by the way. A region, the only district in the whole country with 2 general hospitals. Every district has a general hospital, but Kasese has 2. The reason the population is over 1 million. We will have a regional police commander, RPC, with the 4 divisions, with 4 DPCs. So when you are running for Kasese alone, you then say DPC. That is very small. We say RPC. Because the region is big. The district is big, over 1 million people. Some districts have equivalent of Nyamamba division population. Bondo Liberia Town Council has a population of Ndoroko district. It may be bigger, you have said it. But a town council like this is having a population of a whole district. So when you are allocating it will add on more. You have to have that. Thank you. I can talk and we don't see this, but we are so excited and we're ready to protect and sustainably manage and continue asking for more. I say this for God and my country.
We have done a lot. This is almost the 4th batch of equipment that was supplied to the activities. And Richard and Uganda will work in very many, not only Kasese. Bana Chikusa bring it to us so that one day you'll hear that the regional offices for Congo and Uganda for Western and Kasese don't be shocked. And he say, and as you said, project, we have done a lot with the facilities. Richard, thank you so much. You can send the regards to the Midway to and channel. Banadiecho, thank you for the support. Kao, thank you. LOC5, thank you. I know Chikusa will also meeting the GBV monthly review meetings. And why purposely we're doing this is to reduce the matter. Because if you look at the equipment that were brought, others requested for sanction machine. twins, beds, glucometer, very many things, and of which all these are helping both of Bunyangabu and Kasese. And why we also say that Bunyangabu they should also be considered. You know, Bunyangabu also is almost. We find the patients from Wesumbu crossing to going to where? Chirito. One day I was discussing with Dr. Peter, he told me, Nathan, even though almost half of the teen mothers that get the course for cesarean, and which is very good, and he was very happy about it. And as Richer and Uganda, we don't only deal in health only, we also deal in livelihood, we deal in skilling, we have a peer educator academy. That people are saying they are peer educators. The senior peer educator 001, I don't know which number she is. Almost all of us were peer educators who go in a comprehensive education in Kampala. But we also have peer educators. At our health facilities, which are 15 in Kasese and 9 in Bunyangabu, we have 2 peer educators per facility. So that means we have 48 peer educators. These are the young people who work with the community, with the PhDs, and make sure that the referrals come in. And when the referrals come in, that's why you're seeing these equipments, because we deal with RBF, result-based funding. So we don't give cash. We say per client, we shall give you $1, $2. So we multiply. How many clients do you have? How many dollars shall we give? We convert into Uganda shillings. So we have also the VHT structure which we're working with at the facility. The VHTs are over 80. There are over 80 VHTs across Kasese. You'll find the facility has 4 facilities. And of all those facilities, yes, we made a choice. You know, sometimes you might not cover the whole of Kasese. You know, DHO Kasese has over 150 something health facilities. But we have only 15. That's why we distribute them from Kanyasi, Nyabugogo, Mshenene, Champara, Chinamaseke, Nyabirongo, Charumba. Then we came here with KMC, Kalibu, Karusandara had to reach. We are there for World Environment Day. We have also Ibanda here, we have Mukati, we have Moshenene, and Huira. Huira is also by the Bana cow. Huira is also another hard to reach, very hard to reach. So thank you so much. And these are some of the facilities that have benefited along a lot. Huira was started with it when it was still in the health center 2. And it has upgraded now, it is a health center 3. So we'll have seen transition. And I know even the CEO will tell you transitions have to occur. And we hope that in the next phase, facilities also will benefit more. With facilities, we have done a lot. One, we started with trainings. Trainings for health workers, PHKers and VHT. One, we train them, the PHKers and VHTs will train them on referral. Then the VHTs will also train them on provision of short-term methods. That is Sayana and Depo-Provera. And the PHKers will also train them on distribution of condoms, pills, distribution of pills, which also the VHT do. The VHTs and PHKers also have done a lot in terms of averting unwanted pregnancies and abortions. You have seen DHO at one point you see the graph of Kasese having a lot of post-abortion services given, because we took them through a comprehensive training, both the health workers, the PHKers and the PhDs, to refer mothers who have intended to do abortions or criminal abortions, or some of them that have done abortion miscarriages. At one point, the professor asked us, who has ever got an abortion? People refused to raise up their hands. Okay, yes. How many have ever got a miscarriage? People raised up their hands. So sometimes people misunderstand the word of abortion to think that somebody has done it in a criminal way. So you'll see that facilities like in Nyaburongo now also did mentorship for medical officers in Nyaburongo. For 3 of them, they can now do mean lab of ETLs, where a hospital, Dr. Simon, can do both mean lab and do also vasectomy. Dr. Bija does mean lab, does vasectomies in Bunyangabu, whom we mentored, and we also equip them with things to use. And another thing which we have done is that we have made sure that we have revamped youth corners. For example, the Gosumbu Youth Corner, which is a very vibrant youth corner. Look at Nyablongo, which is coming up now also very strong than even Gosumbu. We have also equipped them with TVs to make sure that the young people also watch educative movies. We have worked with schools. We have made sure that we have interlinked schools with health facilities, so that the young people can also receive services, so that they are not discriminated. Sometime back, I know Mukati DHO, one point Mukati had a very big trouble, where the old were chasing the young ones for antenatal and during immunization. We came to intervene and we told them, no, let the young people also have their day, and also the old people have their day. And the young people are now receiving services. I'm very much impressed now. Recently, the minister was telling me the young people can now easily express themselves. So we have done a lot in the district, also in climate change. Recently, you saw us also attending the World Environmental Day. So we're also doing climate change within the district, and you'll see other regions like in Barara. I didn't want to speak about this. We're also doing kitchen gardening for nutrition purposely, and DHO want also to extend that we want to encourage the young people in the facility to start their gardens around the facility, helping nutrition both for patients and them also to take supplements within their homes. So purposely, that's what we can speak about. But as Richa and Uganda, we have done a lot in the district, and we are still doing a lot within the district. Thank you so much.
Great honor to be invited by the DHO. So I'm really humbled to be really here amidst the leaders of Kasese district and also Bunyangabu district. I might say that the champions of the heroes we have in our different spaces. We are the biggest champions because we're the ones that extend the supervision, extend the need and the support. In 2017, I speak with a lot of courage and vigor because I was the team leader at that time, CEO, but also strong project officer in Kasese district. And I had a chance to really navigate in the surroundings around the district, understand the challenges of young people that they go through, the harshness and the conditions they live, especially the young women and girls. And for me, that was a mark of my instigation to make sure that every resource that is mobilized, at least a percentage, belongs to Kasese district as a place where we feel like young people need to be supported. And I might say that since 2017, when we were working with ACODEV at that time, for us, our footprint in Kasese district has not only become a project-led, there are project-led districts, and I'm going to beat Nathan Chiboko today because I've always told them we are not implementing projects. This is us as an organization being present into the district. So that's why Nathan is reporting will be saying we have been 6 years implementing a project, but nearly we have been almost 9 years in Kasese as an organization. So for us, the impact that we have created in this community, today is like more of a milestone that we are able to celebrate today. But for us to commission the equipment that we have brought, it's not merely just because we want to be, it's like, how can I call it? We're calling it an incentive. It's like a reward. For us, it's not a reward. It's a foundation on which how is it going to support in terms of implementing the work that we're doing, but also the impact that is going to be created in people's lives in the different health facilities that we're going to be reaching. We have done this before in the past years, and also it's something that we are continuing to do, and also something that we're going to continue doing every time. But it's more of an encouragement that we give the health facilities, knowing that the work that they are doing is seen, the work they are doing is appreciated, the sacrifice they are making is all our combined efforts. With our partnership with you, that we are able to extend that appreciation to them not in form of cash, but in form of improving the service they're able to give to their communities. So at Rich and Africa, our mission is really, it's a strong foundational mission, which is so much in terms of empowering communities and to elevate the health well-being of individuals, particularly most vulnerable among us. And in Kasese, not only the town that you're seeing, which hosts the biggest marathon now in Africa, it has quite a lot of challenges. And also our job is also to work with sectors to our city. How can also they extend access towards the work we are doing? When I was in Australia, I was telling people that work in Kasese, and someone said, hey, why are they hosting the marathon? Oh. You get it? I'm like, yeah, why are they hosting the marathon? But already that, for me, was a conversational starter. I'm like, yes, we host the marathon, but the way you said the next the heavens, Karibu, yeah? I'm like, there are spaces like those. But the people, the children, the young people need your service. They need your hands. The other year, was it this year? I think this year I went to, when we went to the outreach together. No, last year.
This year. In Mukati.
This year in Mukati. So I went to Mukati this year. And in Mukati, we met young women who are young girls, dropped out of school, children carrying children. Yes. And you see, child mothers. Some of the challenge of the child mothers is not that they don't want to go to school. They have surrounding challenges in their homes. They have challenging challenges in their environment. But we have to work together in terms of, and this is why they're going to get the health services. It is of quality towards the standards they can be able to receive, and also towards that can support their children to grow. But part of the work we're doing as our regional managers mentioned, it is not only on reproductive health. It's on to livelihood. So what kind of livelihood programs can we co-create together so that we can support some of those young mothers? We have seen it happening in Bara and other districts we're working in, but also those are some of the services that we'd love to really extend. Over the past years, our efforts in Kasese district have yielded to very remarkable results. Through our comprehensive health programs, through our livelihood programs, I remember in 2018, 2017, we used to work with our peer educators to start up their own small businesses. And even at that time, I think we got a grant where we were giving out short loans to some of the peer educators that were able to start up their small businesses. And we saw them flourish. So with our partnership with the district, which we shall also indulge in our discussions more, is to see how do we enhance more youth, more livelihood programs that we can extend to our young people, especially our young women and girls who are child mothers, that can be able to foster their economic empowerment at their homes, in their environment, in their different spaces. Our initiatives have not only educated, but also they have empowered communities, as I've mentioned. We have fostered awareness in reducing stigma around HIV, around maternal health, around different other pandemics that are really affecting our young people. I'm also very happy to say that starting, I think, next month, we're beginning an HIV program, where we got a donor, and Kasese is one of the focus districts. So we're very happy that at least it's also extended, because HIV is also kind of neglected. You've been in different communities, now we no longer talk about HIV. Yet HIV infections and related illnesses are increasing. So we said, no, we cannot really keep quiet. Let us do on-ground programming, let us do behavior change programming, let us also support our VHTs. Because now VHTs, with Nathan here, they've been saying, me, I want family planning. No. How are we providing care and support to HIV positive living patients, but also how we able to stop the spread in terms of extending the messages to the different communities and also different people. So we're putting more emphasis as well on the HIV programming as an organization, and also we urge, of course, we're very happy that we have a very supportive DH. Thank you so much. We really acknowledge your work that you're doing for us. Today we celebrate a milestone that we have both worked together, and also we reflect on our work that we have impacted together, as an organization, we acknowledge it's not only us that have been doing this, but also we have done it together. But also to reflect you back, we did a documentary in 2021 during the COVID pandemic. And I remember the COVID pandemic, we worked strongly with the WHO at the time, and we were giving a lot of PPE equipment and all that. And we were able to extend a lot of support to different health facilities. I'm also happy to say that starting, I think in the next 2 weeks, we have again got some support to support on Ebola. You get it? And it's also part of the support that is also going to enhance. You get it? So for us, we kind of move fast. I know you've been talking about Trump. For us, we're not Trumpism. I hope you don't record this. It might be denied entry. When Reach a Hand started, our foundation is an indigenous organization. And that indigenous organization, as I mentioned to you, that when I came to Kasese, for me, Kasese became heart and part of it. And not only just saying, but even employability. Most of our staff members, I think 30% are from Rwenzori region. You know, and that's how we have, for us, gone ahead to do that. But you see, it's like our business is more of a social business for impact. For example, the WHO is doing a very good job. But I might say even our dear cow, you see, when you went to a hard-to-reach area, you said, you know what, let me serve. You're not saying, let me do a job. So when you're doing this kind of social impact jobs, it's also a social impact business. Then you wake up and go and open up your shop. Now, is your shop business affected by whatever is happening around the world? No, but you have to sell. And customers have to come and buy, and also you get a profit, but also you're providing a service. Your job that you're doing in leadership is a service job because you're serving us. You get it? So when we start up initiatives like this, and what I praise so much is that let us have more of indigenous organizations. If a young person in Kasese comes and says, I have started up an organization, it is better we support that person so much because his root cause of starting up that organization is led by sacrifice, by commitment, by passion. Yeah. So he's also going to be thinking about his business. How is it going to survive, 10 years from now, 15 years from now, 20 years from now? Even when I'm gone, how can my service be remembered? How can it continue? So you find that most of us who are indigenously born, we are driving change from a root cause of passion, from a root cause of how have we grown up, because the challenges that they are facing, they are the same challenges that my people in my village where I come from in Rampara Katereza are facing. You get it? Even where I come from, in my small village, we don't have a health facility or a clinic. We just got electricity recently. We just got water. In fact, we use gravity water, so we don't have national water. But also that gravity water, it was a challenge for us to do what? You get it? They're still having boreholes. You get it? But that village might be lucky because it has another person who are trying to lift it up. So even Kasese, when you have a young person or any other person who has come and said, I have started up my organization, and this organization is going to focus on women and girls. This organization is going to focus on young people. Then it's our job to come together. So that's why, whatever that is happening in the world is not the first time it's happening. It's been happening. But when it happens, does it stop our work in Kasese? No. We continue with whatever that we can. But the biggest funder that we have in Kasese is this office here. Because without this office, that means we're not able to do our work. Then the other biggest donors that we have are the VHTs, the health facilities, the health workers that we're working with. Then the other donors that we have, the biggest ones, are the young people. Because without funding, still I can mobilize you. You get it? And still we can do activities. And these are some of the activities that we've been doing without funding. So everyone's like, is Reach a Hand affected? What? No. The biggest donors we have are these ones. Because they co-create, they think. You get it? Nathan will tell me, I've called the VHO, I'm going to meet him. He's not meeting, but let me go and meet him. You understand that? And when he reaches the DHO, they think, they talk, they get ideas, and they implement. So you're the biggest donors that we have. Not the ones that are outside. The ones that are outside, we partner with them to do business. And the business that we do is the business of creating impact together. So that's the kind of where I'm coming from, also to just relay comfort to our dear DHO that people that are affected by whatever is happening around the world, they've been in business. They have not been driving passion, committed, sacrificed organization. That's why when there's no money, they will say, Kasese, we are what? We are done. We are winding up and we are closing office and they are running away. Yeah, but I want to tell you, as long as they are running away, you're going to remain with us. And we're going to stand with you because the young people in Kasese are not going anywhere. The challenges are not ending. So we have to continue to work together and so that we can address some of these challenges. Today is Ebola, tomorrow is COVID, tomorrow there will be something else. And whatever pandemics that are affecting us are affecting everything. They're affecting business. They're affecting education. They're affecting everything. And also they're going to bring more bigger problems. So for us, that's the core mission that we stand on as an organization. So today we are here to hand over equipment, but I would not just machinery. It's a symbol of beacon of care. I've been talking about it. And it's a promise that will not rest until every young person, every mother feels safe and supported during the different challenges. Childbirth, young people or people living with HIV, young people with disabilities. We're here to develop programs that can really support them through so that they can have an empowered life. So each piece of equipment for us represents a shared commitment to ensuring that no child, no woman loses her life during preventable causes. Let us embrace this opportunity with a lot of determination, and also we are happy about the determination that we found in this office. Let us together build a future where every young person is prioritized, maternal health is prioritized, where every family can thrive, where every leader can enjoy an environment where they can lead. And I want to relay some good news that reach a hand, I think, starting by this year. The process is already done. We have already purchased somewhere. We are establishing an office. And at the end of this year, we're going to have a clinic that we're establishing in this area so that clinic can also be a symbol to support other health facilities. So this one shows that for us, we're here to stay, and we're here to work together. And I've heard your cries. It is very sad for us to be caring for others when our headquarters is not cared for. Now I'm going to ask my regional manager here. We want this boardroom to be done. Yes. So as you're doing purchase of, don't record this because I don't want my board members to assess a district. That's why we are saying we have established in Imbara because we are first catered for home first. Yeah? Because of home, it's not that it's the best performing district for me. You guess it, and he knows. Yeah, but the best performing district for me has been Kasese district. You get it? So that's why when we finished there, I said now the next phase is Kasese district. We have other places like Arua, Nepi, they've given us land. Jumani, they've given us land. Because of the work that we're doing with them and also the work we're doing with whatever. But we said no, even if they have given us land, let us prioritize our base, at least the second best to be in Kasese district. So we are very happy. Where are we going to be? The new place is called. Out of your support. Because sometimes we would love to, even if we are modeling the structures, we want to make them clinic friendly. And also we shall require your support onto that. Other than that, thank you so much. We are so grateful. I represent regards from our board members who are so grateful of our partnership. But I might say that for us, we cherish this partnership more than ever that we shall ever imagine. And for us, this has not been the first time we're doing this. I think it's the third time. And we're going to continue doing it now that we are here. Yeah, so don't laugh when we are here. Also, we shall not laugh when you're here. Thank you so much.
15 sub-counties. I don't know Kasese. There are 44. So for us, we have 15 sub-counties and 13 health center 3s, where we have a support from our Rita Hand, our partner, they are supporting the 9 health facilities. Many thanks for the support you are giving to us as a district. We are very grateful. You have been supporting us in conducting dialogues. You have been supporting us in conducting the outreaches, the family planning outreaches. At the same time, mentorship and coaching in form of capacity building for all our medical officers and the health workers. Then plus the incentives you are giving to us to ensure that we offer services very well. Bunyangabu has a total number of 682 VHTs, and we are among the 80 districts that has benefited from the program of Choose. Choose, it is a structure that has come on ground. It is community health extension workers, and we trained them. They are already working. They are supporting our facilities very well. We have 110. We were picking 2 per parish. So we had the 55 parishes out of 15 sub-counties. So we have that structure on ground. We are requesting that you make also use of them, because they were trained for 16 months and they are already in the system. They are supporting our facilities and they are on ground supporting the VHTs. In simple terms, they are supervising the VHTs. Yes. As a district, we are doing well in family planning because of your support. It's an indicator that we are tracking through OPM assessment, and really you have supported us to achieve. And as I speak, we are planning. We are now having mock assessment, and according to what we are seeing on the ground, I was asking my brother here. They are doing well because of your support, and that achievement is just because of you as our partner. My brother talked about the issue of functionalizing the adolescent corners. As a district, to have a functional health committee at the district level. It is working, only that we may need support from you in case it is there, so that we cascade or everyone knows his or her role. It is working, and we are meeting on quarterly basis. And for the case of HIV, I heard you are coming up on issues of supporting HIV. We are bad off. That's what I can say. The prevalence is 8.3. The prevalence of Bunyangabu is 8.3. Now for the county it is 4.9, which is still even above normal. Maybe WHO, what is the percentage for Kasese? 9. That means
The new infections.
In Kasese. So, as I speak on issues of HIV, we really need your support. I've been moving on ground to ascertain the cause. But one, when we go to circumcision, some people are not eating circumcised. That's what I've realized. So, because of culture. Secondly, there is issue of men, people with money going in for young
Men with money.
That's what I've been moving on the mountains. You see a young woman moving with it, actually carrying another child. So a young child carrying a child. So we still need a lot, especially in the aspect of adolescent health, but also on issues of HIV. On the perspective of family planning, where we are not doing well is men involvement. So I've realized the men are not actively involved. So what I was requesting, if we can also engage men, we actually form many dialogues. We conduct many dialogues. We understand what is making them not allow their spouses go for family planning. You know, when we get these men and they understand the importance of family planning, they will be able to now even influence their women to go for family planning. Now I've met some women, they were like, if I go for family planning, my husband is going to kill me. So for them, they still have the other ideology of saying, we need to produce more and more. Yes, for the case of women, they have really understood. But for the case of men, that's where the challenge is. So I would request that as we are again conducting dialogues, we are there to support, and we see that we call many together and we ascertain the challenge they have so that we can clear off their worries. Ebola, we are trying, but we still need support. I heard the CEO talking of something on Ebola. On risk communication and the community engagement, we've been having many alerts, and the alerts are also, when we go for verification, they are like 2 women who I realized they even came from Kasese. Now for them, they assume as if now there is a problem in Kasese, because they are coming from the border side. However, they were showing signs and symptoms. We verified and they turned negative. So we still need support in case it is there. It is highly welcome. Otherwise, thanks so much for the support you are giving us, and as a district, we are very appreciative. Greetings from Dr. Obed.
Vice Chairperson, Kasese District Local Government. Now 15 days in office, and I'm here representing my senior, who's in Kampala for an official duty, Chairman Elifazi Muhindi Mukombi. We are here for a noble cause, which we have all seen on the ground. Banashio, you are most welcome to Kasese. Yes, we received your team, we shared with your team, and we knew that today we are going to have the commission event. For all the people who are here, I have just very few comments I want to make for you. Reach a hand Uganda, Africa, to me, my observation is that it is not a pocket organization. The mission they have is not a dragon mission. It is not a dragon vision. It is a mission of reality. I know while I spent only 15 days here in office, but when I was working with another organization, a coffee organization called Kasese Coffee Farmers Cooperative Union, reach a hand Uganda, when you go on the ground, things speak for themselves. This is really an achievement to Kasese district. It is a gain which we must protect as Kasese district. Then on the behalf of the leadership of Kasese, I will encourage my technical officers that we see how we really protect whatever equipment we have got from Reach a Hand Uganda, Africa. I know sometimes people, you find things are given, but sometimes people have a different concept, which me myself I call a wrong concept. Reach a Hand Uganda has given us a variety of items, which we are going to commission now. But the wrong concept, I will talk about that. To me, it is a negative one. It is where you are supported And then in the long run, the implementation, even when the project is over, and you still say the project is for reach a hand. Ownership, lack of ownership. And when we lack ownership, it means the sustainability of that item given to you, it is doubted. So therefore, I would encourage all the health workers in the health sector that as we receive the items, we need to see how we can really protect them, and we see that they are really helping our people on the ground. Reach a hand, Uganda, Africa. I know when I looked at your description, I saw that you are really showing us that it is really youth-centered. The youth-centered approach has really helped the youth of Kasese district, because you have a focus in some areas of reproductive health, which I think our youth are being sensitized about. You have a focus on AIDS awareness, creating awareness and prevention of AIDS. This is a great achievement in Kasese district. In the spiritual context, as I wind up, when we are praying to God, we say, God, can you come and heal our people who are sick? And when we call for a support, reach a hand, Uganda, Africa, and you come and support us. To me, in the spiritual context, I would say that is a healing hand extended to Kasese district. Ladies and gentlemen, as Kasese leadership, for us, we are there to offer support. Any support you need, we shall offer. And I would like to say, when you are implementing your activities, try to make sure you evolve the politicians such that we can also create awareness. Because in most cases, when a doctor, you are aware that sometimes when you reach a function, you may not be given the platform. But the one who will be given the platform is the politician. Therefore, if politicians, if leaders are involved in these interventions, then we may realize more than 100%. Thank you so much. Thank you so much for coming. Extend our greetings to other members that you left in the offices, that Kasese district is very happy receiving the variety of items that we have seen outside, which we are going to commission, and we continue pledging our support to you in any form you'd like to be. Thank you so much for listening to me. I wish you a happy stay here.